I think that for many years, the risk of stroke during pregnancy and the postpartum period, even though there is some level of awareness, but it's never really translated into an action plan. So I think that, for that reason, since it has no real action plan, essentially stroke specialists, and perhaps neurologists have never been involved in this care pathway or in the care of patient women who actually are becoming pregnant or in their care in the postpartum period. So I think that, clearly there is a need to expand this multidisciplinary team that's involved and involving stroke specialists as part of that multidisciplinary team is something that is a true derivation of the results that we saw. So I think that our study showed some interesting findings. So, obviously, a history of a previous ischemic stroke does increase your risk of having a ischemic stroke during pregnancy and in the early postpartum period. There was some, one is actually what we do know about things that actually during or events that are happening during pregnancy that increase that risk. So obviously, the hypertensive disorders during pregnancy, there is actually a certain level of increased coagulability or increased tendency to form clots that happens during pregnancy. So obviously, monitoring for that is an important component in this particular high-risk group of women. I think from a research perspective, also in our study, we found that women who were on aspirin or actually were treating blood pressure medication seem to have a lower risk of having a stroke. So it does actually open. So, one, there is a good news here that perhaps that risk is modifiable and can be reduced with the appropriate medication. And it does actually open the pathway for studying new medication, that can actually mitigate and reduce the risk of having an ischemic stroke, particularly in this particular category.